British Association of Dermatologists in combination with the Zoe symptom tracker data. So they're working together on this. And it gives lots of cutaneous manifestations of COVID here that people have photographed themselves, people that are doing the COVID symptom tracker app, and they send in. So there's all sorts of different manifestations in the mouth, in the skin, in the digits, legs, abdomens, armpit there. So all over the place, different types of rashes. But then if we're looking at digits today. So if you click on that one, we can actually see some COVID digits here. So it gives you quite a few to choose from. In fact, there's more pages of it as well. So I think we can see here, for example, that there's quite a lot of redness here on the toes. And it looks quite red and inflamed. You can clearly see that there. I think the red fingernails have got a different cause. The red toenails have got a different cause. Or there's another toe there, and again, quite sore and inflamed looking toe. And there's also examples from there's some fingers here as well. Yeah, there's some fingers as well. So if we look at this COVID digit, so we see this kind of red inflamed area here on the fingers. So do click on that site. You'll be there for ages because lots of interesting things to look at. You can look at oral manifestations or urticarial manifestations or neck and exposed chest eczema. Tempted to click around a few more there, but we won't. I'll leave you to look at that yourself. Now, what we want to do now is look at the paper that's just come out on this. Now, this is the paper here. It's from research from France. That's the paper there. Now, if you're a consultant dermatologist, physician, or experienced biochemist, I would recommend reading this paper for yourself. If not, I probably wouldn't bother because it's about the most difficult paper to read I think we've ever reviewed on this channel. It really is quite a stodgy paper full of jargon and things. So it's taken me a good few hours to decode it myself. So I'm going to give you the gist of it here. And there is some pretty interesting stuff coming out. So COVID toe, British Diabetic Association of Dermatology. So that was the one we've just looked at, the pictures we've just looked at. That is the link for the paper. So the objectives of this study: to study skin and blood endothelial and immune system activation. So is this activating the immune system is the question. Now the endothelium, so if you take a cross section of a blood vessel like that, you typically have an outside layer, then you have a middle layer like that, and then you have the middle layer is a bit thicker, then you have an inner layer there. So that would be the middle layer there. That would be the outside fibrous tissue layer there. And then on the inside, you've got this nice smooth layered cells, the what you call squamous epithelial cells. So the cells are on a basement membrane like this. If we take a blow up of a bit of there like that. And the nice flat cells like this, the what we call squamous cells. And of course, the nice and flat cells, so it's easy for the blood to flow over the cells in the vessel without causing turbulence. You get nice laminar flow of blood. You don't want turbulence in the blood vessel. So that's the vascular endothelium that they are studying in. And it's the same in all blood vessels, really. It's just in a capillary, for example, all you've got is the basement membrane and this. And then you've got smaller vessels like arterioles and venules where you have differing amounts of elastic tissue and smooth muscle in the walls. So anyway, what they're studying here is they're calling them chilblain-like lesions, CLLs. That's what they're calling those things we've just looked at. And they're looking at chilblain-like lesions in comparison with healthy controls and seasonal chilblains, which they're calling SCs, seasonal chilblains. And chilblains are cold-induced sporadic chilblains occurring during, well, the ones they looked at as a comparator group were 2015 to 2019. So what happens with chilblains is people that are prone to this, the cold causes inflammation, and then they get this area of inflammation called a chilblain, which is often quite painful for the patient. They really have to make a big effort to keep their feet warm. But of course, in England, or Northern America or Canada, that's quite difficult in in winter. So that's what they're comparing anyway. Observational study carried out in France. So fine. Now, they actually only had 50 patients in here, but it was an observational study, basically a convenient sample. And they looked at cytokines. Assay means to measure the level of. Cytokines are these, if you have one cell there like that, one body cell there like that, and you have another body cell here, maybe a different type of cell, then a cytokine is a chemical released by one cell that diffuses to another cell and has an influence on this second cell. It's a cytokine. Cyto cell kine movement. It makes the cell do something, not necessarily move, of course, more likely to be a biochemical change. And they also did assessment of interferon, stimulated gene expression in whole blood. So basically that's looking at the activity of interferon. Now, we've looked at interferon a few times before. Interferon is a chemical released, a cytokine released by a virally infected cell that goes to other cells and tells them, oi, just a minute, there's a virus in the area, so stop producing as many proteins. And it has various effects on the cell that protects it against viral infection. So if you had a viral infected cell in the middle there, interferons are released, and that's going to warn and therefore stimulate defences in all the cells round about it. So it sort of compartmentalises the viral infection. That's what interferon does. It is interfering with the activity of other cells, but usually in a positive way. So they looked at that. They also looked at soluble markers of endothelial activation or angiogenesis. I told you this was a difficult paper. So angio is blood vessel, genesis is beginning of. So what happens is if a blood vessel is damaged, suppose you have some blood vessels there, for example, taking blood to an area. If some blood vessels are damaged, they'll have to be replaced, and that process is called angiogenesis, making new blood vessels, or sometimes called angioneogenesis, making of new blood vessels. So they were looking at that. Basically, I think that's as a response to damage of the blood vessels that new blood vessel would have to be generated. Histological examination examined the tissues under microscopes. They looked at lateral flow spike assays, looking for virus in the tissues and in the blood. They were able to, via sophisticated techniques, they were able to look at endothelial cell counting in the circulation. So the idea here is that, again, if you had damage to the vascular endothelium, some of these cells might break off and therefore circulate in the blood. And if you could find these cells circulating in the blood, that would be an indicator of endothelial damage, is I believe what they're saying there. And then, of course, they did lots of stats on the whole thing. Right, what were the results? Histological patterns were similar in chilblain-like lesions and seasonal chilblains. So basically, the abnormality, the histopathology under the microscope looked much the same, indicating these are both primarily inflammatory conditions. Primarily inflammatory conditions, but it's not inflammation caused by the SARS coronavirus 2 itself. It's inflammation caused by the body's immunological reaction to the virus. And this is really important because, of course, the main life-threatening condition, the acute respiratory distress syndrome, or the formation of all these micro emboli, these little blood clots you get in the vessels, all that is an immunological reaction as well. So to understand the immunological reaction that you get to the virus is really very, very important part of understanding the whole disease process. Transcriptomic, so in other words, to do with transcription, the reading of the genetic material signatures, overlapped in both chilblain-like lesions and seasonal chilblains. In other words, the reaction that this had on the body cells, again, was similar. The way that the body cells responded, started transcribing their DNA into RNA to make protein via the process of translation, was similar. In other words, the pathophysiological process was similar. It was type 1 interferon that was produced, which now pretty well all cells in the body, probably all cells, certainly most cells in the body have interferon receptors. So pretty well any body cell, if it's exposed to interferon, that will warn that cell that there's a viral bacteria, that there's a viral infection around. Sorry, I said bacterial then, I meant to say viral. There's a viral infection around, and the interferon the interferon that's warning the other cells can also cause other inflammatory reactions. So that's why they're looking for the levels of interferon. That's part of what's causing this inflammatory reaction. Chilblain-like lesions were characterised by higher tissue immunoglobulins. So there was immunoglobulins in the tissues. Oh no, I've missed one out, sorry. Let's go back. Cytotoxic natural killer gene signatures. So in other words, there was activation of cytotoxic natural killer cells, these NK cells. So in the blood we have white cells called lymphocytes. There's a class of cells called lymphocytes, and there's two sorts of these. There's large and the small lymphocytes. Now the small ones are the B and the T lymphocytes, and the B lymphocytes are the ones that produce the antibodies. They produce immunoglobulins. The T, you might remember, there's T helpers, there's T suppressors, and there's T cytotoxic cells as well. So the helpers help the B cells to produce the antibodies. They produce the antibodies. The B cells produce the antibodies. But only when the helper cells help them to. The suppressor cells tell it when it's time to turn that response off, and the cytotoxic cells directly kill virally infected cells, as do the large lymphocytes. So the other class is the large lymphocytes, and they also kill virally infected cells. So this is the sort of this is the group of small lymphocytes there. That's what they do. Then this other class of lymphocytes are the large ones, and these are called the NK cells, the natural killer cells. Now, we used to think that these acted to kill a lot of different virally infected cells, but we now know that these now recognise specific viruses as well. So they're natural. These are big cells, and they just kill the whole virally infected cell. And these will act straight away, whereas these ones take a while to learn. They need to go through a process of clonal expansion. The small T cytotoxic cells before they can start combating the infection, whereas these ones will work very quickly. So cytotoxic natural killers were activated, and there was immunoglobulin type A in the tissues. Now, what happens here is if you get immunoglobulins in the tissues, then they're not really supposed to be there. So they generate their own immunological inflammatory reaction, because the immunological cells have chemicals in them that can kill bacteria and kill viruses. So, for example, in immunological cells, like the white blood cells, there's an enzyme in there called lysozyme that will digest bacteria. Now, that's fine if it's all contained inside the cell, inside its right vesicles. But if that gets out, and some does when the cells are damaged, some gets out, and that is very insulting and inflaming to tissues in general, because it can do things like digest protein. So it causes an inflammatory reaction. So that's the link between the immunity and the inflammation. So when you get immunity, you tend to get a degree of inflammation as well. That's kind of the way that's working. There's more complement and angiogenesis factor in COVID-like lesions. Now, complement's another pro-inflammatory cytokine, and there was angiogenesis factors. So these are cytokines that stimulate the process of blood vessel healing, angiogenesis, indicating that blood vessels have been damaged, so the body's trying to heal them. And in other words, this causes an autoimmune vasculitis. So vasculitis is inflammation of blood vessels. Auto is self-immune processes. It's an autoimmune vasculitis. Confirmed endothelial dysfunction as well, so there's damage to the lining of the blood vessels. So basically what we're saying is there's activation of interferon and activation of natural killer cells. That damages the blood vessels, and that leads on to damage of the tissues as well through the deposition of immunoglobulin type A in the tissues. So you've got two causes, and the tissues themselves are damaged. The skin is damaged in this case, and the blood vessels are damaged. Microangiopathy, so micro small angio blood vessel pathy disease of. So there's disease in the small blood vessels, and that leads to clinical chilblain. So that's what's leading to this. It's partly the disruption. So it's the immunoglobulin type A in the tissues and the disease of the blood vessels, which of course is somewhat analogous to what we see in the lungs, really, isn't it? Where there's disease in the blood vessels and inflammation in the lungs themselves. So this could really be giving us vital information about what is killing people in COVID-19. This is why this is so important. It also disrupts the thromboprotective status of the endothelial cells. So the endothelial cells, these cells that are lining the blood vessels, you don't want blood clots. An abnormal blood clot in a blood vessel will be a thrombus. You don't want that. So these cells are releasing chemicals that prevent the blood from clotting. And there's a homeostasis between pro and anti-clotting factors that normally leads to nice liquid blood. So the blood you see in a wound is a bit thick. You know, blood that comes straight out is liquid. It's the clotting things that make it thicken up and eventually clot, of course. So, and that can likely leads to microvascular thrombosis. So small blood vessel clots within small blood vessels. So if that's one of your small blood vessels there, like that, then the microvascular thrombosis would be a blood clot forming inside that small vessel, blocking off that vessel, meaning the bit of your finger or toe that's normally supplied with blood by that vessel doesn't have enough blood supply. Therefore, it becomes ischemic. It hasn't got enough blood supply. Therefore, it becomes inflamed. What about systemic endothelial activation? Is this happening all over the body? Well, the prothrombin ratio and the activated prothrombin time were normal in all patients. So these are measures of blood clotting. So what this is saying is the blood clotting was normal. So like if you've got if your international normalization ratio is 2:1, that means your blood's taking twice as long to clot as normal. But what they're saying is these were 1:1. The blood clotting was normal in these people. Indicating to me, at least, the way I understand this, is people that have COVID fingers and toes are not likely to have overall body inflammation. This seems to be a bit of a separate disease process, but using the same pathophysiological mechanisms. Only three patients had a moderate increase in D-dimer levels, so that's not really that significant. Now, D-dimer is when you get blood. So if you get a blood clot, forming here in a, imagine that's, let's have a red pen. If you get a blood clot, imagine you get a blood clot forming there. Now the body doesn't want a blood clot because it's blocking off the blood supply. So what you have is you have various mechanisms in the blood that start to dissolve this blood clot, process called thrombolysis. And when you dissolve the blood clots, the D-dimer is one of the things that's released. It's a protein that's released as the blood clot dissolves. So if the D-dimer levels are high, that means you've got thrombosis because the body's trying to get rid of the thrombosis, but it's a marker for the presence of thrombosis. But that wasn't systemically raised in most people. So it's saying that systemic thromboembolic complications were not really a big issue. Conclusions: inflammation in the skin associated with endothelial alterations, immune infiltration of cytotoxic and type 1 interferons leading to clinical manifestations. So there it is. It's basically cytotoxic NK cells. Did I say T cells then? I didn't mean to. They're not T cells. They're natural killer large lymphocytes. And the interferon leading to these clinical manifestations. Now, practically, that's the end of the difficult bit. Dr. Ivan Bristow, UK podiatrist, like the regular chilblains typically seen during cold spells and in people who have problems with circulation, the lesions usually go on their own. So that's pretty good news. Usually go on their own. Some may need treatment with creams and other drugs, however, but most go away on their own. The confirmation of the cause will help to develop new treatments to manage it more effectively, which of course is brilliant. And then this doctor here is a spokesman for the British Dermatological Association, herself a consultant dermatologist. COVID toe was seen very frequently during the early phases of the pandemic, but it's less common in the current Delta variant wave. Interesting. So, but of course now we have many more vaccinations on board and many more people. That might be down to more people being vaccinated, having some protection against infection, or infection from immunity from past infection. Presentations after vaccination are much rarer, so vaccination is protecting against this, which is probably the main reason. And delayed presentation may mean it's missed. In other words, some people get this a week or 2 or 3 weeks after they have the COVID and therefore may not associate it. So I don't think ever has a disease, maybe with the exception of HIV, which was pretty extensively studied, been so rapidly studied. New things being discovered all the time. Okay, this fingers and toes might not sound important, but it is to the people that have it. But as well as that, it's indicating perhaps something fundamental about the way that this virus is killing people via the body's own immunological response. So sorry that was a bit stodgy, but feel free to watch it again if you'd like to, and thank you for